Hello, this is Dr. David Greene, CEO of the Washington Pain Network. The topic today is the basics of migraines. Migraines is a chronic headache that affects people from anywhere from a few hours up to 72 hours straight. Migraines are a complicated, recurrent headache disorder that's most common in women and those between the ages of 15 and 55. Most become less severe and less frequent with age. Migraines affect 18% of women and 8% of men. 30 million people in the U.S. have at least one migraine every year. Every 10 seconds, someone in the U.S. goes to the ER with a headache or a migraine. 70% of migraine sufferers have a first-degree relative who also suffer. If one parent suffers from migraines, there is a 40% chance that a child will suffer. If both parents suffer, the chance rises to 90%. Over 90% of sufferers are unable to work or function normally during their migraine. There's a lot we don't know about migraines. We know that there's genetics and environmental causes. It looks like there's imbalances in brain chemicals because it's been shown that serotonin levels do drop during migraines. Low serotonin, which is a pain management chemical, can trigger a migraine by letting too much blood flow through vessels that should be constricted, and that induces a throbbing sensation. So typical migraine triggers, there's quite a few of them. Various foods such as aged cheese, red wine, beer, whiskey, fruit, citrus fruits, additives, caffeine. Elevated stress, weather changes, strong scents such as perfume, hair accessories, exercise, poor posture, skipping meals, and smoking. All these can be triggers. One of the small silver linings in life is that there's no evidence to clearly substantiate that chocolate is a trigger of migraine headaches. Thank God that's a myth. Symptoms of migraine, often it's a unilateral head pain that is throbbing and aggravated by activity. An aura is a visual or sensory symptom prior to the onset of the headache, such as photophobia or these visual scintillations. 8 out of 10 migraines actually don't have that. To make the diagnosis of migraines, there really is no objective testing available. Most neurologists or pain doctors will get a CT or MRI scan to rule out badness in the brain. Other than that, it's diagnosed on patient history and a pattern of symptoms. A migraine diary can actually be very helpful to show what the triggers are for a patient, the duration, and how frequent they happen. International Headache Society requires a patient to have at least 5 attacks fulfilling these 3 criteria. One would be a 4 to a 72-hour duration. At least 2 of these, unilateral, pulsating, moderate to severe pain, or aggravated by or causing avoidance of routine physical activity. And at least 1 of these, nausea plus or minus vomiting, photophobia, or phonophobia, which is sensitivity to light or sound. Now, abortive treatment options, there are quite a few medications. The triptans target serotonin. Serotonin, remember, was the was the chemical that causes dilation of blood vessels and throbbing. So triptans can counteract that. There's various ones: almotriptan, elatriptan, frovatriptan, naratriptan, and the list goes on. Sumatriptan is probably the one that's most of a household name. Additional ones include acetaminophen, isomethiptine, dichloralphenazone, which is Migraine. There's also Migranol nasal spray, Cafrago, and there's some over-the-counter ones too: Advil migraine, Excedrin migraine, and Motrin migraine. Additionally, one may include narcotics, barbiturates, nausea medications such as Reglan, Compazine, or Phenergan can all be helpful with decreasing symptoms. When it comes to preventive options, obviously what we're trying to do is do just that, prevent migraines and decrease the frequency. A lot of medications are used off-label for this purpose. One of these is beta blockers. Another would be calcium channel blockers. Those are normally used for high blood pressure. Antidepressant medications such as Elavil and Pamelor can be great. Anti-seizure medications, gabapentin, Topamax, or Depakote, and then a serotonin antagonist, Pyzatifin, which is Cenomigran. Interventional treatments. The FDA has approved Botox injections for chronic migraines. They can be given at 3-month intervals, and there's injection into 32 sites in a 10-minute procedure. So a lot happens in that 10 minutes. It is covered if certain medications have been tried and failed. For chronic migraines, it's characterized as distinct and severe neurological disorder characterized by patients who have a history of migraine and suffer from headaches on 15 or more days per month, with headaches lasting 4 hours a day or longer. So it really is those with chronic severe migraines. Patients treated with Botox average 8 to 9 fewer headache days per month compared to baseline, and that was a large study, and that's how the FDA approved it. Additional treatments include occipital nerve blocks, cervical facet injections, cervical epidural injections, phenolpalatine ganglion blocks, supratrochlear nerve blocks, supra or infraorbital nerve blocks, and then pulse radiofrequency of the occipital nerve. So there's quite a few options for interventional procedures. These are all extremely low-risk procedures. Now, looking at outcomes, study of 100 patients receiving greater occipital nerve blocks, 53% achieved pain relief averaging 3 weeks. There was a retrospective study on the efficacy of greater occipital nerve blocks in refractory migraines. And in this study, 54% reported being significantly better after the blocks, and the duration lasted up to 6 months. So 6 months is a huge length of time for migraine relief. Another one looked at peripheral nerve blocks and treating migraines, and they looked before and after greater occipital and supraorbital nerve blocks. 85% effectiveness rate for 6 months. So that one they did even better. The top migraine pain management in the Washington area is with the Washington Pain Network. There's multiple clinics throughout the state of Washington. Over 50 insurances are accepted, with over 25 treatment options being provided. Success rates on average for all types of pain conditions is over 90%, with the board-certified, award-winning doctors. Visit us online today at WashingtonPainNetwork.com, and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the Washington Pain Network. Your pain stops here.